This video is not intended to replace our individual counseling, which is tailored to the very specifics of your condition, but is provided as a general supplement of a condition or treatment. Cataract surgery is one of the most common surgeries performed in the United States. It is a very safe surgery, however, it does involve surgery with instruments inside the eye and corresponding risks. This surgery is performed with anesthesia around the eyeball and some sedation that can be given by an anesthesia provider through the veins. This combination allows good pain control with local anesthetics, as well as relaxation from the systemic medications. The procedure itself should not be at all painful, and if at any point you have pain during the surgery, please say something, let me know, and we can apply more local anesthesia around the eye or give more relaxing medications intravenously. The surgery itself is generally fairly short. A typical cataract surgery may last about 20 minutes from start to end, but I always tell patients to get in a comfortable position so that you could stay in that position for 1 to 2 hours if there was some reason that the case went unusually long. The surgery itself involves coming into an OR, getting draped with a sterile sheet, and then small instruments making small incisions on the cornea, on the clear surface on the front of the eyeball, putting instruments inside, and using ultrasound energy and water to break up the old lens that is inside the eye, vacuum that out, leaving the bag behind that lens was in, and then putting a plastic intraocular lens inside that bag. That plastic lens goes there and helps focus the light and stays with you for the rest of your life. There are a variety of options for this lens that I discuss in a separate video that I encourage you to watch, and I'm also happy to discuss any and all of them in more detail with you in person. Once this new lens is put in the eye is closed up and the surgery is over. After the surgery is over, I put a shield over the eye to protect it from accidental injuries, and then I plan to see you the day after surgery. Depending how things look on the day after, I typically see patients at a week and a month, but the post-op care is variable over the first month after surgery. There are also several eye drops that you'll need during the post-op period, which we can discuss in more detail, but typically include both an antibiotic and a steroid to reduce inflammation. During the first week, at least after surgery, I ask all of my patients to sleep with a shield over their eye at night that is taped securely into place to prevent any accidental trauma to the eye. And I encourage people to do light to moderate activities, nothing too strenuous for the first week. So not lifting things over 10 to 15 pounds, trying to minimize any bending, lifting, or straining. No swimming for the first month, as I don't want the eye submerged under standing bodies of water. And I tell people not to shower for the first 24 hours, and then okay to shower, but trying to minimize any contact water has with the eye itself for the first week, and lightly dabbing the eye dry with a towel, but only with very minimal pressure applied to the eye for the first week. The logistics of the surgery are communicated by the surgery center and my surgery scheduler, but a general overview is that the surgery is a come and go surgery, meaning that you come to the hospital, we do the surgery, and you return home the same day. An hour or two before the case starts, in order to get you ready for the surgery, get the IV placed, get things changed, and so that everything can be a smooth experience. And then usually people stay for half an hour to an hour after the surgery to kind of recover and feel good. So the entire experience can be a typical 3 to 5 hours. The obvious benefit of cataract surgery is that there is no other treatment except surgery to remove the cataract from the eye and improve the visual symptoms that are caused by the cataract, whether that is glare or blurry vision or both. However, it is a full ocular surgery and there are risks involved with cataract removal. I think of these risks in four sort of separate categories. The first category is based on the lens selection. I have an entire video dedicated to choosing the right lens, but occasionally, despite our best measurements and best calculations, a lens that we think will give you a very good outcome for minimizing the amount of time you need glasses will not be the perfect power for your eye, and so glasses will be needed more often, and some patients end up needing bifocals after cataract surgery. That's probably the most common complication, but the least severe. The next category of risks is a fairly broad bucket that includes many different types of potential complications. All of these are very unlikely to happen, but together they do give a small probability of patients not obtaining the good vision that we hope for them after cataract surgery. Some of these risks include things like swelling of the retina, persistent inflammation, corneal edema, macular holes. There's a very long list. When all of these are combined, it still is uncommon for any of them to occur and reduce vision, but together they give a small probability that we don't achieve vision that is as good as we hope, but is generally still functional vision. Another category of risk is the risk for needing repeat procedures or additional surgeries. It is fairly common to need a future laser procedure after cataract surgery. That is in the ballpark of 10 to 40% might need a laser touch-up in the years following a cataract surgery and is an in-office procedure. A very small number of people will need an additional surgical intervention that requires a return to the operating room. Often these patients do very well after their return to the operating room, but it is sort of a scary period to go through and does increase the risk of long-term reduction in vision. The final category of risks from surgery are severe risks. These are extremely uncommon but can lead to severe to complete vision loss. They include things like infection inside the eye and severe bleeds inside the eye during surgery. So while these are very uncommon, it's important to know that no surgery is risk-free, and that the risks of the surgery have to be weighed against the benefit of improving your vision through cataract extraction. At this time, there is no other treatment for cataracts other than surgery to remove the cataract and replace it with a plastic lens. And overall, this is a very safe surgery, but it is just very important to understand the risks of surgery before you undergo a surgery. So I am happy to talk about these risks and your particular risks in much greater detail, but this video is just meant to give you an introductory overview of the cataract surgery, risks and benefits associated with it. Thank you.